welcome. Thank you for being here. We're going to begin this important event with a prayer by Chaplain Kora.
Thank you, Alison. It's such an honor to be here with you today, and I know that we're all probably a lot of different faith groups in here and stuff, so I'll pray according to my faith beliefs, and you pray according to your faith beliefs, and we'll all say amen at the end, okay? So let's pray. Creator, we're so grateful to be here today and to talk about this important subject. God, I just want to thank you for everyone that is here, the workers, the survivors, Father, everyone that has something to do with preventing suicide. God, I know that your heart breaks when your creations make decisions that cause their lives to end. And so, Father, I pray today that you will help us become better at preventing this terrible tragedy. I ask, God, today that you will be with anyone here who is continuing to mourn their loss. And I ask today, God, that we'll learn new things to be able to help others. Be with us. May everything that's said today be glorifying to you. Thank you for this day. Thank you for the people who put this together. May your blessings be upon us. In the name of your Son, amen.
Thank you, Chaplain Kora. Thank you for being here. I want to welcome each and every one of you here and online to the 5th Annual Suicide Prevention Conference. I'm Alison Traynor. I'm a therapist at YouthWorks and Summit Counseling, and I'm also a co-founder or one of many founders of the North Dakota Suicide Prevention Coalition as a nonprofit. Our mission is to provide hope to all generations to prevent suicide. I just want to take a look at this amazing schedule. The folks that are speaking today, including Dennis Gillen, a national speaker, and Seth, a youth advocate. We're just so excited to have you. First, I want to say thank you to our amazing sponsors. We have the North Dakota Department of Health, the North Dakota Behavioral Health Division. Both have supported this tremendously. Please give a round of applause to Clint in the back. That is really running the sound here from the Department of Health. And please give a round of applause to the Behavioral Health Division for supporting our speakers, particularly Mariah Ott. I also want to say thank you to Midwest Doors, Leo Seasoning, Garing Landscaping, and First Link for their support of this event. We could not do it without you, and we could not do it with each of you supporting this effort. Next, I just want to take a moment to thank our conference committee. Please stand if you were a part of the conference committee. Thank you. These are volunteers, folks. These are the real deal. They have all done this with their time, their effort, and so this is, a nonprofit organization, and so it takes all of our elbow grease and all of us working together, and it just means a lot. So thank you. These are also the folks that you want to talk to about your CEUs if you have questions. For folks that need to sign up yet, there's credit hours available for nurses. Sign up on the social work board sign-in sheet if you need to do that. There's also sign-ins for social workers, counselors, and law enforcement. So thank you, special thank you to law enforcement for being here today. I just want to thank you. So very briefly, before I kick it over to Kora, Dockter, our coalition chair, I want to talk a little bit about the coalition beginnings. And I don't want to understate the importance of the folks that have been doing this work in North Dakota since the 1990s. There have been folks working as the North Dakota Suicide Prevention Coalition for a couple decades now. However, the North Dakota Suicide Prevention Coalition only recently became a nonprofit. So it's a new organization. We're working together to prevent suicide by providing hope to all generations. So we know that suicide is cross-cutting, and we know that we have a long ways to go. The Suicide Prevention Coalition is also working with partners like yourselves, many of you, law enforcement, organizations like Chaplain CARS, Crisis Chaplaincy Organization, and many others to basically provide connection. We're connectors. We provide free evidence-based training to communities across North Dakota. We provide support to folks that are grieving losses upon request. We also partner at the grassroots level to advocate. So please, if you have any questions, if you want to donate in any way or support the cause with your story, that is the most powerful gift that you can give, is your story. So I want to start today by talking about how the most important strategies begin with the belief that suicide is preventable. We know that suicide is complex, and it's the result of many factors, including depression. However, we also know that it is preventable. If you've lost someone to suicide, that might feel difficult to think that suicide is preventable. So let me clarify. One of my good friends and respected colleagues, Brenda Bergen, once told me that if our love and care was enough to keep someone safe from suicide, no one would ever die from suicide. So please know that if you've lost someone, that what I'm talking about is that suicide is preventable if we all work together. Suicide is preventable when we invest in it at the level that we invest in cancer, at the level we invest in other things like all other accidental deaths. We invested in seatbelts. We invest in some of those things. So I just want to clarify. Does that kind of make sense? Okay. Before I turn it over to Kora, I just wanted to mention that to be keeping in mind why people die by suicide during this event. We have some powerful speakers that are going to talk about their lived experience. We're going to hear about all the data, some of which is very, very difficult to hear. Okay, so please take care of yourself. If you need to step out, we certainly understand, but we will probably follow you and check in with you to make sure you're okay. So give us a thumbs up if you need to step out, just for safety. So according to the American Foundation for Suicide Prevention, suicide occurs when our distress exceeds our ability to cope. So today I want you to be thinking about the fact that we all kind of have a scale. We have all the positive protective factors in our life, like all the good stuff, our family support, our positive friends. On the other side, we might have trauma. We might have our risk factors. We might have our depression. And so all of us have the task of keeping this in balance and helping others to keep things in balance. So today we're going to learn a lot about how to tip the scale towards hope and towards life. Lastly, as we think about emerging from the COVID-19 pandemic, I just want to key into something I say often, and so I apologize if you've heard me say this a great deal. But when we think about suicide prevention, we know that people that die by suicide have overlapping factors, 3 factors. According to Thomas Joyner, an American psychologist, we know that people that die by suicide have a lot of feelings. They feel alone, whether it's real or perceived. They feel like a burden. And we know when people suffer from depression, oftentimes it's like they can't see the truth. They can't see that they're loved or that people will miss them if they die by suicide. It's important to remember that. The last factor is what we talk about as the capacity for suicide, the desensitization towards the act, the fact that people that have been through really difficult things, trauma, as well as people who have the capacity and comfort to act due to rumination of suicidal thoughts or due to a history of self-harm or even access and comfort with things like firearms, are fearless when it comes to taking their own life. These 3 factors are what we really have faced in the pandemic. People have been isolated, They may have a sense of a lack of purpose because of losing their jobs, feeling alone. And they also might have fewer coping skills that they can use in replace of these negative coping skills like rumination and self-harm. So these are things to think about because they guide the way. And so what you'll hear today is you'll hear messages of hope and help, and you will hear that we can make a difference. And the way to do that is somewhat simple. We're going to be talking about giving people a sense of belonging and connection, giving people coping skills, and also giving people a sense of meaning and purpose. That's what we're doing today. So please listen for these things. I think they're very important. And lastly, take a moment to put these numbers in your phone. Make sure you have the National Suicide Prevention Lifeline in your phone, 211, and also the First Link text line. These calls and texts are answered locally, folks, so really utilize that. Lastly, let's reflect on this amazing agenda and all the effort that volunteers have put into this. And I'd like to end with our mission that we're here today to provide hope to all generations. And I'm going to turn the mic over to Kora Dockter to talk about her mission and Stephen's story. Thank you.
Okay, Alison does a much better job than I do, so. My name is Kora Dockter. Keep that up there. I had to put who doesn't like puppies, especially in the morning. That's my little 4-pound Yorkie, and when she was sleeping like that, I'm like, oh, I wish I could be a Yorkie for a little bit. So I wanted to show you that. I want to just do a little bit of housekeeping first, because there's a lot. We've got, thank you for everybody that's online. The virtual, I think we had over 400 registered. Thank you for everyone coming in person. We're so glad to be able to be in person. Last year we just did all virtual, so we like the hybrid of each. There's benefit of being together. So for those of you online, just know that your microphones are automatically muted and your video is disabled. So we can't see that on this side. Please use the chat feature to ask any questions for the presenters. And when we have a lunch break, you guys, the ones virtually, will have a break. So our lunch break is about an hour and a half. So you've got the agenda, you can see that, but you won't be, there's nothing for you to partake in at that point. I'm going to my list, I'm sorry. There is a change on the agenda, and Dennis Gillen is switching with the data piece, so we're just flip-flopping. So there's a little bit of time difference, so just so you know that. There's surveys on your table in the blue folder, and please fill those out. It's important to get feedback from different areas so we know where, or so we know, First Link knows of what areas are needed. We need to identify those areas because we can't make a difference in areas if we don't know that. So please fill that one out. We also have our evaluation, and I will tell you that I read every single one, and that is used in the planning for the next one. So put down what you want to see, put down what we maybe shouldn't have put, whatever, write what you want, it's okay. We like any kind of feedback. Just going to go over a couple events. This summer there's going to be a motorcycle ride from the Canadian border down to the Mexican border, and it's going to be used to raise awareness of suicide and suicide prevention. The name of it is Wish You Were Here. If you plug that in, you'll find their website to find out more information. Donations that they get from that ride will be used for the coalition. They're hoping that even if, they're going down Highway 83, so not taking the back roads, but they're going down Highway 83, and so they'll stop in the towns along the way. They're hoping people will join up with them and ride however far they want, but they will be doing that in 4 days, so I give them credit for that. And then on February 25th, the Bobcats, they are having their 25th anniversary celebration. You will, for a free will donation, you'll get a 25th anniversary hat. I've looked at them, they're beautiful. Farmers Union helped with that. And that will be Suicide Awareness, Suicide Prevention Night. So they are hosting that for us as well. So they have told me that there will be deep discounts on tickets. So bring your family, bring everybody. Just say you're with the suicide group. And I believe that's how you would get the ticket when you go to the ticket office. So they said something about free food tickets, but so hopefully that works. But please join us. That is the only event you will get those hats at. So, and we thank those who help sponsor and help us move forward. As Alison was talking a little bit about, Alison and I are considered the founders of this group. I want to say though, if I can do this, is it on here? There we go. There we go. This is my son when he was young. Truly, we're the founders of it, but this is who started it. At least he's who started my journey into this. And I always say we find our passion through work, through somebody else, or through pain. And so, unfortunately, it had to be that way. That's another, was his first little girl. That's him at Christmas. Oh, I'm going to go back. But truly, I had challenged him when he was really sick. He was the kind of person that helped others. Like, he would throw out the lifesaver ring before anybody else, and he'd be the one that would help them. And so I challenged him. I'm like, Steve, you need to get better. We need to fight this. And it obviously he did not. So when it comes to Steve, when he was dying, and I say I watched him die, over the months, the last 4 months of his life, he wasn't eating, he wasn't sleeping. Just in your mind, think about that. Think about what your body would be going through, what your mind, how would you function at that point? Those are physical needs to keep going. And then you add depression on top of that, and it's all, there isn't much left. I sadly say that about 4 weeks before he died, I prayed to God he would take him, because watching him die was no different than watching somebody with cancer die. He was so emaciated. And so he would tell me, Mom, it hurts so bad. Not emotionally, well, emotionally, spiritually, but the pain, the physical pain, that is something that surprised me. I didn't even consider that. But basically you're starving to death because you can't eat. So we've got a lot of work to do. I think a couple years ago I talked to somebody from Blue Cross. I'm like, why are we not feeding these people? Why are we not putting tubes in so they can eat? And she said, I said, they're losing tons of weight. And in her mind, she goes, well, if it's over 5 pounds, we probably could. So we've got a lot of work to do to get people to understand and recognize this as an illness. When you look, insurances have cut out areas of mental health. Like you've got coverage for your heart, you've got coverage for your lungs, you've got coverage for every other area. They don't limit your visits for that, but mental health has been cut out and they've got limits here. Sorry. Those are some things we need to change. In North Dakota, 80% of our population has insurance. 10% is on some kind of a state insurance, and 10% is uninsured. And unfortunately, we throw our hope in the basket of what's the state going to do. They're doing a lot. I give them a lot of credit. But my son never would have walked into a human service center. He would have used the general, clinic, hospital, that sort of thing. So that is an untapped area that we really need to get to. Let's see here. About the coalition, I will let you know that you guys will get an invite to the coalition. We are, after kind of a long winter's nap, maybe 2 winters, we're up and running again. And our first scheduled coalition meeting that everybody is welcome to is May 11th. Is that right, Sarah? I think it's May 11th. Yeah, so we'll send something out for that. We want to have everybody involved. We might hang out a help wanted sign because we know that everyone's got time and talent, and so we might try to tap into that a bit. And I just want to say a couple more things. I might run just a tish over, but my name is Kora, Dockter, and I want to live. That is the saying. Where are they? Which group? By Holding Hope. That's a support group. That is what you get to say when you're in that. And I will tell you that I have been there. I did not want to live after my son died. It took a long time. When you are so depressed, it's incredibly hard to even pick up a phone to call somebody for help. So be that person for that person. We really need to create a village around people. We need to stay with them. We need to help them. Maybe it's come in and say, let's do laundry. It is so important to help them make that next step. Help them call First Link. You call First Link. If you're not sure what to do, you've got a friend, neighbor, whatever, call First Link. They can help walk you through what to do. They can help you do that as I've referred providers. There's a pediatrician. I said, what do you do? She goes, I don't know. I'm like, call First Link. So truly, if you don't know what to do, don't do nothing. If somebody says something about suicide, they're testing the waters to see if anybody is taking them seriously. So truly, if they got to the point where they actually said it, listen. One of the other support groups is this SOS. Put those down. It's the SOS. I want to tell you that when we were there, we went after our son died. One of the other things that we had to say when we went around the room was, my name is Kora, Dockter. My son, Stephen, died February 21st, 2014. It took me 6 months to even say my name. It took me a little longer to say the rest, because if I said it, it was real. And so my husband, Brenda Bergen, wherever you're at, my husband would say it for me. But it's those kind of things that we do want to prevent the families. There's been about five suicides that I know of since January 1st, and 2 of them have been immediate friends or whatever of my immediate family. So we're not on a good roll. Let's see here. I know you're going to be bugging me here. We did bring a donation box. Feel free, if you can, talk to your employers if they don't mind doing a donation. They can go to ndspc.org, and that is on the top of that donation box. If you'd like to do it in memory of somebody, we would love that. And I know I have to. I have so much. I always do. I think I need a walking mic next time, Clint. This is my mantra. I found this on the wall at Mayo Clinic, and I loved it. It is, we must not be content only to see things as they are. We must have the vision, faith, and hope to see what things can and must become. And it was Sister General Gervais that said that. And I truly believe that's true. I'm an impatient person, and when it comes to this, and when I hear of a death, it just gets me right here. Partly because I know what that family is going to go through, and I know what their friends are going to go through. And so that's a loss. And that's one more that we probably could have prevented. So keep that in mind. I want to jump over all the hurdles, and I want to get to the point where we're doing the right thing, especially in the insurance area. We need to fix the system at the system level for everybody, or it won't work for anybody. We know there's different groups that have a higher rate of suicide, but if it's not working for anybody, it won't matter. So that's why our mission is for all people. So just so you know, thank you for coming. I wish I could go around and speak to everybody, but I'm going to go and mask up now. And you guys, I hope you learn a lot. Thank you.